Hello friends, today we will discuss general examination of long case presentation. So, during general examination of a long case of internal medicine, what are the things we need to look for? So, today's topic of discussion is long case presentation. Long case presentation and in general examination, what are the things we need to look for? General examination, what are the things we need to look for? So during general examination, we look for appearance of the patient. We look for appearance of the patient. We look for appearance of the patient. Then build, nutrition, decubitus condition, cooperation, anemia, jaundice, cyanosis, clubbing, koilonychia, leukonychia, edema, dehydration, bony tenderness, pigmentation, lymph node, thyroid gland, breast, body hair, pulse, blood pressure, temperature, respiration, and any other relevant. Like we have to look for any lesion in the neck, axilla, and head, like alopecia, or skin lesion if there is there any skin lesion present or not. Even we have to look for any IV cannula, NG tube, or any drainage tube. We have to look for, and we have to look for is there anything around the bed like sputum or any body sample around the body. So we have to look for the surroundings of the patient during general examination. Now brief discussion about the general examination. A doctor must be good observer like a detective. So everything the doctor must have a keen eye on the patient from head to toe. He first look from head to toe of the patient. He will stand right side of the patient, then he will look from head to toe. Any abnormalities. Firstly, he will look the appearance of the patient. Appearance, he must look for the appearance of the patient. Is he look well looking or ill looking? Does he look depressed or anxious? Does he look cushingoid or expressionless face? Like in Parkinson disease, patient have expressionless face. Patient with Cushing syndrome may have a cushingoid face. Patient may be depressed or ill looking, or patient may look pale. Patient may look toxic in case of sepsis. Patient may look toxic in case of sepsis. So then we have to look for the general build of the patient. Does he look obese? For obese patient, we may think of metabolic syndrome. For emaciated or cachectic patient, we may think of patient having some malignant disease or tubercular disease or chronic disease. Patient may have a tall stature or short stature that may indicate some genetic disease. Or does he look normal, body build? Then we have to look for the nutrition of the patient. Does he have oil nourished or poor nutrition or normal nutrition? So nutrition will indicate some, like patient having some GIT disease may have malnourished, or a patient of malignancy may have poor nutrition. So, or it may indicate his social status or economic status in the society. So, nutrition must be looked for. Then decubitus status. What is the position of the patient? That is the patient's most comfortable position. Is he Mohammedan's prayer position? That is patient sitting and leaning forward. What happens in pancreatitis? Or he is kept propped up, or he can be in any sitting, any posture, or lateral bending. So everything indicates some disease. So in case of propped up position, usually patient having some heart disease or heart failure, they feel good in a propped up position. So that the posture is very important before going to a diagnosis. Then we have to look for the anemia. Anemia is the pale coloration of the pale coloration. It is indicated by pale coloration, but actually it indicates lower hemoglobin level in the blood. So where we can see it? We can see it in the palpebral part of the conjunctiva, and also we can, as a whole, the patient may look pale. Then we can see it in the tongue, palm, nail bed. In the nail bed, we can think a patient is having some anemia. So we have to look. We must need to know, is it mild, moderate, or severe? Severe anemic patient may have anemic heart failure. He needs rapid resuscitation of hemodynamic circulation by intravenous blood. So the anemia, we must look for the anemia. Anemia indicate many diseases. It may be due to malignant disease. It may be due to lower hemoglobin production in CKD. It may be due to hemoglobin lysis in some hemolytic disease. So it indicates a loss of disease. So we must look for the anemia, and we must have to look for the severity, mild, moderate, or severe. Then we must have to look for the jaundice. Jaundice is the yellow coloration of the body, skin and urine, and subconjunctival mucosa, but it is actually due to raised serum bilirubin in the blood. As like anemia, we have to look for, it is seen in the sclera and under surface of the tongue and whole body, and as well as palm and sole. So as like anemia, we have to classify it as mild, moderate, or severe. Usually deep jaundice indicates some obstructive jaundice. Obstructive jaundice indicate deep jaundice. So if some patient having deep jaundice, so we can assume that patient having some obstructive jaundice. We have to look for the cyanosis in the tip of the nose, lips, ear lobule, tongue, and tip of the finger and toes. If patient having some shortness of breath or low blood pressure and patient is cyanosed, so we can think that the patient have some source of hypoxia. The hypoxia may be central due to heart or lung causes, or it may be due to peripheral like hypotension. So we must have to think of, in case of cyanotic heart disease, patient have central cyanosis. In case of peripheral vascular causes, peripheral arterial disease or hypoxia, that will be presented with peripheral cyanosis. So cyanosis must be looked for, because rapid resuscitation of hypoxia by oxygen is very important here. We must need to look for the clubbing. Clubbing is evident by fluctuation test of the nail base. Fluctuation test of the nail base. So angle between nail and nail base and curvature of the nail. So there will be elevated curvature of the nail bed, and there will be angulation between the nail and nail base. So that is clubbing, and fluctuation test is used to detect clubbing. So clubbing occurs in various diseases. We will discuss later on. So, and there is another clubbing that is called differential clubbing. Clubbing in the toes, not in the fingers. So clubbing, it is also called parrot beak appearance. Parrot beak appearance. It looks like parrot beak appearance. Drumstick. Sometimes it is called drumstick. Sometimes it is called parrot beak appearance. So clubbing identification is very important. It is found in many suppurative lung disease, in various liver disease, and it is also present in various sorts of malignancy. So clubbing detection is very important during general examination. Koilonychia. Koilonychia is the dryness of the nail or brittleness of nail. Sometimes it looks like thinning and spooning. So it is characterized by dryness, brittleness, flattening, thinning, and spooning of the nail. So usually koilonychia indicates iron deficiency anemia. In case of the iron deficiency anemia, patient may have dryness, brittleness, flattening, and thinning of the nail, sometimes spooning. So from koilonychia, we can think of patient having some iron deficiency anemia. Then leukonychia. Leukonychia is whitening of the nail. It is the whitening of the nail or white nail. So in case of hypoalbuminemia, due to different causes like protein losing nephropathy or gastroenteropathy or liver disease, patient may have leukonychia. Leukonychia indicates patient having low albumin in the blood. Patient having low albumin in the blood. So another thing is edema. Edema is detected firstly in the in the leg, above the medial malleolus on the medial side, or over the sacrum when patient is recumbent position. Edema indicates generalized when patient having some generalized edema, that indicates patient having some systemic disease like chronic kidney disease, chronic liver disease, some intestinal disease, or patient having some malignancy, or patient having heart failure, or patient having pulmonary hypertension for a longer duration. So patient either having heart failure, either having right-sided heart failure or pulmonary hypertension, patient either having some sorts of CLD, or patients having CKD, or patient having some IBD, or patient having some malignancy. So edema indicates the systemic venous congestion in the body due to either it may be due to low albumin production, or it may be increased albumin excretion from the body, or it may be due to heart failure, pumping failure of the heart, or it may be due to renal failure, or it may be due to liver failure. So edema indicates there is a systemic failure of venous return, due to different causes. We look for later on. Look for the causes later on. Then we have to look for the dehydration by skin turgor or dry tongue. From the tongue, we can look for the dehydration. But in the bedside, if we from the besides skin turgor or dry tongue, we must have to look for blood pressure, pulse. Is there having low blood pressure, or having tachycardia with having scanty urine. Low urine output may indicate dehydration in a setting of vomiting, diarrhea, or low water intake. So dehydration must be corrected as soon as possible. So we must have to look for dehydration. Then pigmentation. So pigmentation, we should look for the exposed part of the body. The exposed part of the body, face, neck, palmar crease, knuckle, inner side of the mouth, recent scar. Pigmentation may indicate Addison disease. Pigmentation may indicate some local skin disease. Pigmentation may indicate liver disease or kidney disease. So a lot of disease can be diagnosed from evidence of pigmentation in the patient. We must have to examine the lymph node in different sides of the body, like in the neck area, in the axilla, in the groin, in the abdomen. So in the different parts of the body, we must have to look for lymph node systematically. Then we have to look for the thyroid status. And two things. Firstly, we have to look the thyroid gland. Is it palpable or enlarged? Then we have to look for the sign of hypothyroidism or hyperthyroidism in the body. Like patient may have fine tremor in case of thyrotoxicosis. Patient may have mixed edema or non-pitting edema in the leg due to hypothyroidism. So sign of hypothyroidism or hyperthyroidism we have to look for later on systematically in the systemic examination. But in the general examination, we must have to look in the thyroid gland that it is enlarged or not. It is palpable or not palpable. So then we have to, if the patient is female, with permission and with maintaining privacy, we have to check the breast for any mass lesion. Bony tenderness is very important for diagnosis of blood malignancy or hematological malignancy. For diagnosis of hematological malignancy, bony tenderness over the sternum may be a first diagnostic clue. Body hair distribution from head. Body hair distribution may indicate lots of disease, like systemic lupus erythematosus present with alopecia. So body hair distribution is very important. A case of polycystic ovarian syndrome, a female may have male pattern hair distribution. Then in the general examination, we must have to check the pulse and blood pressure. The pulse and blood pressure will indicate the patient's hemodynamic status, and it may indicate any underlying cardiovascular disease. So pulse and blood pressure is in the general examination. We must have to look for any abnormality in the pulse, like any abnormality in the rate, rhythm, volume, character and condition of the vessel wall. At the same time, we have to look for any abnormalities in the blood pressure, asymmetry of the blood pressure, or collapse of blood pressure on standing. So there may be high systolic blood pressure, low diastolic blood pressure, wide pulse pressure. There may be narrow pulse pressure, like low systolic blood pressure, high diastolic blood pressure. There may be a narrow pulse pressure indicating impending shock. So the pressure variation is very important in general examination. Then we must have to record the temperature. Patient may be febrile. So maybe it is high grade or low grade. It is continued, intermittent or remittent. For recording, for For recording of pressure temperature is very important before coming to a diagnosis in case of a fever patient. So temperature record is very important. Without record of the temperature, the history taking will not be complete. Respiration. In the respiration, we have to look for the rate of the respiration. Usually below 20, it should be from 18 to 12 to 18 per minute in case of a normal patient. And we have to look for the depth of the respiration. It look like Kussmaul breathing or chain stroke breathing, or patient may struggle with poor respiration, poor air entry. So respiration pattern must be looked for in the general examination. Then we also have to, from head to toe, we have to have a good look. We have to a through look, and we have to look for any patient having any xanthelasma, may indicate dyslipidemia, corneal arcus in case of dyslipidemia, xanthomatous nodule in case of dyslipidemia, skin rash in case of any it may be due to viral rash, or it may be due to some connective tissue disease, or it may be due to some bacterial rash like meningococcal meningitis may present with some skin rash. So skin rash is very important before going to a diagnosis. Then alopecia will indicate some disease. Then scratch mark indicate patient may have some jaundice or obstructive jaundice. Patient may have some scratch mark in the body. Rheumatoid nodule may indicate rheumatoid arthritis. Dupuytren's contracture also indicate some rheumatological disease. Primary erythema, same like some liver disease or rheumatological disease may present with primary erythema. Osler's node in the nail bed and splinter hemorrhage may indicate patient having some infective endocarditis. Haberdon nodules or Boucher's nodule may indicate some rheumatological disease. Gangrene of the nail, in fact, may indicate patient having some diabetic foot ulceration or peripheral vascular disease. Patient may have ulceration in the body. Patient may have telangiectasia. Wasting of the body, one side of the body may indicate some autoneuron disease or paralysis, or indicate cerebrovascular accident. Patient may have spider in a patient of CLD. Patient may have parotid enlargement in a patient of mumps or CLD. Patient may have stria in case of pregnancy or Cushing syndrome. Patient may have Campbell-De-Morgan spot excessive amount due to liver disease. Patient may have purpura in Hennes-Cullen purpura in the buttock. Patient may have purpura, or patient may have some some clotting factor or coagulation factor abnormality. Patient may have purpura, or patient may have vasculitis with having some purpura. Patient may have some autoimmune disease and vitiligo. Patient may have some kyphosis, scoliosis, and some rheumatological disease like ankylosing spondylitis, juvenile arthritis. So all this from head to toe, examination from head to toe is very important in case of general examination before going to systemic examination after history taking to get a conclusive diagnosis. Thanks for listening.